right, we're just going to talk about the knee. So just kind of this space right here. It's not its own chapter or anything like that. It's for the book that we use, but it's still something that I want to kind of separate out a little bit. So first is just the patella, right? So you can see here, it's nice and mobile, right? It's nothing weird if you can move it around. If you've been an athlete, especially if you're getting a little older, then you may feel like a little grinding underneath there, and that's just from being active. It's nothing to worry about. But the patella is really important when you think about your rehab process, right? What it's doing. If it's not lined up properly or if it's not moving enough, then boy, it can cause you all kinds of issues. So, but with the patella, so you have a superior pole, so that's going to be right here. You have an inferior pole right here, and then you have the medial side and the lateral side, right? So you can move it in all of those directions, right? You can tilt it, you can move it back and forth and everything. So that's just a joint mobilization there at the patella. That's really simple for everybody, right? So that's that. Now remember, we got that quadricep tendon that's coming down to the top of the patella, and then we've got that quadricep tendon. I'm sorry, the patellar tendon or the patellar ligament that's running from the inferior pole down to that tibial tuberosity. So as part of like your knee eval and our palpation process, if you start with a bent knee, makes your life a lot easier, because what it does is it moves that kind of edge of the tibia out of the way. So now you can get in there and you can feel where the meniscus is. So the medial meniscus is going to be right here. Lateral meniscus is going to be out here. In addition to that, you have your pes anserinus, right? So that's going to be that, remember that's the three muscles that come around. You have that sartorius, gracilis, and semitendinosus all coming around to that pes anserinus area. So they all attach to that same tendon. You also have your tibial tuberosity. Remember, that's important because that's your quadricep attachment. And then you have Gerdy's tubercle, which is right here. It's not in the book that we use, but it is there. A lot of people get that mixed up with the fibular head. So the fibular head sits way back here, almost on the posterior lateral corner, right? So the Gerdy's tubercle is important because that's your IT band, right? Your IT band's running down and kind of attaching into there. So you have all of those important landmarks. Now you also have obviously the condyles. So if I go back to that joint line, I push up, that's going to give me those femoral condyles. I push down, I get the edge of that tibia a little bit. And then I also have that adductor tubercle right here. Remember, that's an insertion point for us as well to help you find that adductor magnus. So that's all those big landmarks there around the knee for bony landmarks.